Welcome to this edition of Research Connection. Joining me today is Dr. Amanda Ziegler. Thanks for joining me.
Thanks for having me.
So tell us a little bit about yourself.
So I'm Dr. Amanda Ziegler. I'm a veterinarian and a scientist at NC State here in this comparative gastroenterology research lab. It's led by me and Dr. Anthony Blixlager.
Neat. And you recently got a grant, correct?
I did. I just got a NIH K01 award, which is it's a grant from the Office of Research and Infrastructure Programs at the NIH. It's a special emphasis career research award for early scientists, veterinarian scientists that are developing their independent research programs.
Okay. So what is the research?
So what we study is intestinal epithelial cell barrier function, and what we have found in my work during my PhD here in this lab was that we use pigs to study barrier repair after ischemic injury or loss of blood supply to the gut, which occurs in a lot of different diseases that we see in the clinics. And what we have found is that the gut can repair itself really quickly in the older pigs, but when we looked at younger pigs, specifically nursing piglets, we find that they can't repair their barrier function basically at all. But we were able to rescue that by applying basically the gut microenvironment from the older pigs, juvenile pigs, onto the younger pigs in our in vitro system. So we were able to see them repair, which is really promising because that shows that the gut is capable of repairing itself in a young animal. We just need to figure out what it is that we did, what it is that we applied in that homogenate from the older pigs that prompted that rescue. The reason that's important is because we know that younger patients that have gut injury have worse survival rates and worse mortality, worse morbidity related to ischemic injury, and that really hasn't been explained. And so our pig model, which is really translatable to both human health and also other animal species like horses which suffer from colic injury, we might be able to use this model to translate our findings to improve outcomes in these young animal and human patients. And so my project, and specifically my K01 grant, what I've proposed to do is to move these in vivo and ex vivo studies that we've been doing with the pig model into an in vitro system in cell culture. So using our cell culture systems here that we have to culture glial cells, which are part of the gut brain, with epithelial cells and study restitution of the barrier in vitro so that we can get more fine-tuned look at the restitution mechanisms and how they're impacted by the glial cell network, the gut brain, because we propose that the gut brain develops after birth and therefore might be immature in these young pigs, which might be explaining the defect in the the repair mechanism.
That's fascinating.
Yeah.
Huh. And do you have any collaborators with this?
Yeah, so this whole gut-brain idea came from our work with Dr. Ben Lanigan. We share a lot of lab space and time with Dr. Ben Lanigan, and she's a brilliant glial cell expert in the gut. So she came to us years ago and said, you really should look into the glial cells. I really think that that's an important part of this question that you have here. She pointed out to us that it develops after birth, and so it could be immature in our younger aged animals, and we've been working with her to show that they actually are reduced in our younger pigs. We've used advanced imaging techniques to verify that those are definitely reduced in our younger pigs, and so we're on the right track to be able to show that glial cells are important in this process. We work a lot with Jack Odell on main campus in the animal science department because he has the swine facilities and access to facilities to be able to look at this from a nutritional perspective, and he also sources all of our pigs for us for these studies. And then obviously Anthony Blixlager is instrumental in he taught me all about epithelial repair in the gut, and it's helping us to design and implement these studies. All of these people, including also Scott Magnus at UNC, with the CGIBD, our collaborative group with the GI group at the medical school over there, and he is my primary mentor on my K award, and so he's helping me develop all these in vitro injury and repair systems and using a transwell culture model system.
That's a lot of brain power.
Yes, it is. And without this mentorship team and without these collaborations, I wouldn't be able to have come up with these great ideas and gotten the support. So I feel really fortunate here.
Yeah, and congratulations.
Thank you.
And best of luck.
Thank you.